Good to see you again, Alessandra. Welcome back.
Thank you.
So what happened to your foot? I heard that you hurt it?
Yeah.
Okay.
I was playing soccer and I got hit in the head, unfortunately, by the ball. So it knocked me down and I fell in a certain way and I sprained my ankle.
Oh, wow. Okay. So the ball hit your head, left or right side of the head? Left side. Right here?
Yes.
Okay. I do feel a little bump right there. Okay. And then you fell and you've hurt your left or right foot?
Left. The whole left side of me just went down and I...
Left foot and ankle.
Yeah. I couldn't walk it off. I needed my teammates to help me.
Could not walk afterwards. Okay. And were you knocked unconscious? Were you knocked down unconscious? Or did you retain your consciousness or throughout?
I think I was unconscious for about 8 seconds.
8 seconds. Oh, wow. That must have been quite a hit.
Yeah.
Okay. Do you experience any pain right now?
I do. My head, where the lump is, I do feel soreness, tenderness there. I do feel it. But then this is what I feel a lot more. It's a lot more prominent, and I just, I would love to not feel pain there, but yeah, it's kind of intense.
So we're gonna take care of the pain today, for sure.
Thanks.
So on a scale of 1 to 10, how much in pain are you now? Over at your foot?
Honestly, I'd say 7.5.
7.5 out of 10.
Yeah.
Okay. And how would you describe the pain? Is it throbbing or is it kind of dull, sharp?
I'd say there's a constant throbbing going on.
Okay. Any blurred vision or double vision right after the hit on the head?
No, I definitely had double vision for not too long, but I definitely experienced that.
Double vision. Would you say a few minutes or hours?
Probably about 2 minutes.
2 minutes, okay. Any ringing in your ear that's abnormal? Any sounds that
No
bother
ringing.
you? Okay. So no ringing in the ears. Are you on any new medication by any chance?
No.
Okay. How's your back? Do you have any back pain? Any pain anywhere else in your body?
No, it's just mostly my head and my ankle.
Okay, so I'm gonna definitely go ahead and do a cranial nerve exam and check your head area.
Okay.
Make sure that from a neurological point of view everything is okay. And then we'll focus on the foot.
Okay.
Okay. And have you taken any medication for the pain there?
I took some ibuprofen.
Okay. Just, do you remember the dosage?
I think it may have been 800 milligrams.
Okay, so maybe 1 pill, 2 pills?
It was 1 pill.
1 pill, okay. So definitely did not exceed the daily allowed dosage for that. All right. So let me go ahead and set this aside. And I'm going to put my gloves on. Okay, I'm just going to take a look at you. Just making sure I'm not missing any visual signs. Okay. And how long ago did the accident happen?
It happened 2 days ago.
2 days ago. Okay. Any heart palpitations? Any, abnormal breathing?
No.
Excessive sweating?
No, none of that.
Okay, let me go ahead and feel your pulse first. So just relax. Okay, so going to compare it with the one over on the other arm. Okay, they are symmetric. Gonna feel it over your brachial carotid artery as well. Okay, pulse is normal. I'll feel it over your brachial artery as well. Okay, that's normal. All right, I'm gonna go ahead and palpate your head, and I'll be careful around the left area here. I can feel the bump right here. Good. Yeah, it's a little bit raised, but it's very localized. Is it painful when I press down on it?
A little bit, yes.
A little bit, okay. And I'm noting that you do not have a fever. No excess swelling is indicated. I'm gonna go ahead and listen to your heart and lungs. Okay. Just breathe normally. Just making sure that your vital signs are okay. Okay. Good. Heart sounds normal. S1 and S2 can be heard. Not hearing S3 and S4. Okay, take a deep breath in for me. And out. Deep breath in. And out. Deep breath in. And out. Okay, can continue breathing normally now. Good. Lungs sound normal. I'm going to listen in the back as well. If you could put this hand over here for me. Just breathe normally. And now deep breath in and out. Good, perfect. One more time, deep breath in and out. Good. So lungs sound perfectly okay. Same with the heart. Going to just make a note of your vital signs. Normal temperature, lungs and heart normal. Left cranial area bump can be felt upon palpation. Normal pulse. Good. Right. So I'm going to go ahead and check your pupil response in both of your eyes. You can look over into the distance for me. Good. 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 Perfect. Okay. I'm going to cover one eye and show you one object. Make a note of the red intensity that you see. And is that level of red the same as this one?
Yes.
Good. Okay. Now continue looking into the distance. I'm going to show you a couple of colors at the periphery of your field of vision, and I want you to try to identify them.
Green.
Okay.
White.
Okay.
Orange.
Good.
Blue.
Good.
Green.
Perfect. Okay. Now I want you to try to keep your head steady. Look at the light right here. Good. Now look at my nose. Look at the light again. My nose, my fingers, the light again, and now follow the light. And keep your head steady. Good. Checking your binocular vision. And I'm going to bring it closer to your nose. Try to follow it as much as you can. Perfect. Very good. All right. Next up, I want you to look at me. I'm going to cover one eye. And you do the same. Cover one eye with your hand. And I want you to try to count how many fingers you see.
2.
Good.
2.
Good.
1.
Good.
5.
Perfect. And now I'm going to move my fingers out of your field of vision. Just say yes when you don't see them anymore.
Yes.
Good.
Yes.
Good.
Yes.
Good. Now cover the other eye as well.
Yes.
Good.
Yes.
Good.
Yes.
Good. Now cover the other eye again. And I'm going to bring the fingers into your field of vision. Say yes when you see them.
Yes.
Good.
Yes.
Good.
Yes.
Good. Now cover the other eye.
Yes.
Good.
Yes.
Good.
Yes.
Perfect. All right, so your eyes are okay. And if there was anything neurologically wrong with you, I would have seen some symptoms already when I was checking your peripheral vision, your pupils, your eyes. Close your eyes and just say yes when you hear a sound.
Yes.
Okay. Is the sound coming towards you or moving away from you?
Coming towards. Moving away. Moving away.
Okay, now point towards the sound. Good. 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 Perfect. Okay. Now I'd like you to lay down, face up first, and I'm going to take a look at your knee, your ankle, and your foot.
Okay.
Just going to do a visual inspection of the top of your legs and your feet first. I'm looking for any discoloration, any bruises. I'm not noting any lesions. Okay, a little bit of an inflammation over on your left ankle, around the ankle. I'm gonna go ahead and measure the ankle. 5.5 centimeters, and the unaffected one is about 4.9. So a little bit of an inflammation over here. Okay. Knees do not look affected at all. No signs of edema. Gonna go ahead and palpate. checking the temperature first. Okay, even temperature. No excess sweating. No signs of edema. Is the ankle painful?
Mm-hmm.
A little bit, okay. I'm gonna go ahead and percuss and check the integrity of your bones. Okay. Right tibial is intact. Left metatarsals. Okay. The ankle bones are intact. So is the left tibial. Any discomfort here?
No, there is just a little bit on my ankle.
A little bit around the ankle.
Mm-hmm. Only my left ankle.
Okay. Okay. The bone is intact, but I am feeling a slight inflammation. Okay, I'm going to go ahead and check your pedal dorsal pulse. Okay, good. 2 plus synchronized. Not feeling any other lumps or bumps in the inner portion of the foot. Okay, I'm also going to check the posterior tibial pulse. Good. I'm going to inspect your toes. Can you wiggle them? Good. Okay. Do you feel this?
Mm-hmm.
Do you feel this?
Yes.
And this?
Mm-hmm.
Good. Nails are intact. Can you bring your left big toe towards your head? Good. Okay. Can you relax it now? Can you do the same with your right big toe? Good. You can relax it now. Now can you do the same with both big toes? Good. And relax. Okay, can you bring this middle one towards your head? Good. And back. Good. And now can you bring this toe towards your head? Good. And relax. Perfect. Across the foot, I see 7.9. 7.9. Good. 1.4. 1.4. 4.2. 4.2. Good. So your toes are not swollen. Okay, I'm going to do a neurological check of the top of your legs. Just say yes when you feel me touching you with a slightly sharp object.
Yeah.
Good.
Yeah.
Good.
Yes.
Good.
Yes.
Good.
Yes.
Good.
Yes. Yes. Yes.
Good. And is this sharp or dull?
Dull.
Good. Sharp or
Dull.
dull? Good.
Sharp. Sharp. Dull. Sharp. Dull.
Do you feel this?
Yeah.
And this?
Yeah.
Sharp or dull?
Sharp. Sharp. Dull. Dull. Sharp.
Good. Checking the skin underneath the superficial layer. Okay, good. Good. Okay. Very good. Can you feel this?
Yes.
Good. And this?
Yes. Yes. Yes.
Good. Okay. Five, 9, 2.3, 4.5, 2, 2.9, 3.1. Okay, so a little bit of an inflamed ankle, but other than that, the nerves and the dermatomes in your legs are okay. Now I want you to flip face down. Okay. Next up, I'm going to check the plantar region of your feet and the calves muscles. Any pain right here?
A little bit at the ankle.
Okay, on a scale of 1 to 10, how much pain do you feel?
It's still about a 7.5.
Okay. Alright, let's go ahead and inspect the plantar region of your feet. Okay, I'm not seeing any discoloration or bruising. Can you wiggle your toes? Perfect. Okay. Right. I'm gonna go ahead and just measure your ankle. Okay, 1.9. Okay, 1.8. So a little bit of an inflammation over here. 2, 1.1. Okay, 1.3. 1.2 thirds. 1.2 thirds, good. Alright, do you feel this?
Yes.
And this?
Yes.
Okay. Is this sharp or dull?
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Dull.
Good. Okay. Is this cold or warm?
Warm. Cold. Cold.
Good.
Warm.
Good.
Cold.
Good.
Warm.
Good.
Warm.
Good.
Cold. Cold.
Good.
Warm. Cold.
Good. Is this sharp or dull?
Sharp. Dull. Sharp. Dull.
I'm going to go ahead and tap on the plantar region of your legs, and I want you to tell me if you feel any pain. Good. Okay, go ahead and wiggle your toes for me. Okay, so I'm going to do a couple of range of motion tests. Does this hurt?
Slightly my ankle, but
Does this hurt?
no, that's better.
Okay. Does this hurt?
Slightly.
And this?
Slightly.
Okay, good. A little pain, but you're able to move your leg in those directions. Can you rotate your leg for me? Oh, perfect. That's good. Very good. Is this painful?
No.
This?
No.
This?
No.
This?
No.
Flexion? Painful?
No.
Good. Can you rotate your leg for me? Good. Okay. You can lower them now. Okay, I'm just going to take a couple of measurements that are a little more precise. 4.5, 5, 7.7, 7.4, 8.5, 8 and 3/4, 5, 5, 4.1, 4. So a little bit of an inflammation over here. Going to go ahead and apply a little bit of kinesiology tape around your ankle, and that's going to keep the ankle warm and promote healing and relaxation. Okay, let's see how much we need. Okay, it's about that. Gotta make sure I get the ankle bone in there. Good. All around it. Nice. Okay. Okay, Alessandra, so I did a very thorough examination of your head as well as your legs and your feet. From a neurological point of view, everything is okay. So that's what we're most worried about with the fall. You have a sprained ankle, so go ahead and just take it easy for the next couple of days. Keep the kinesiology tape that I placed on there. That's going to promote healing and relaxation and keep the area warm. Do you have any questions for me?
No, I don't think so.
No? Okay,
Thank you.
Good to see you again, and hopefully I'm not going to see you too soon for anything new.
Thank you. I appreciate everything you've done.
All right.